Guys, what's going on? Dr. John here, and we're here with Stephanie Scarce,
Hi.
who is a wonderful client of the Garden Medical Spa.
Yep.
And I'm so happy that you've joined us for this podcast.
Thank you. I'm happy
Absolutely.
to be here.
So, Stephanie, you're a very important guest to this podcast because you have first hand knowledge of our life optimization program.
Yeah.
And I mean, you've been featured on our life optimization posts.
I have.
On Instagram.
Yeah.
And I think it's been like a really good thing, good relationship.
Oh, it's been awesome.
And I think that, the point of this podcast is to hear about your experience with life optimization, and also to like hear about you as a person and like, the stuff that you're involved in and things like that.
Yeah. Well, the program, I say this to everybody and everyone thinks I'm bullshitting, but it really did like change my life.
That's awesome.
My postpartum life after having my son.
So let's go through that actually.
Yeah.
So we met about like 2.5 years ago.
Yep.
I take care of your son
Yep.
because I'm a pediatrician as well. For those of you that don't know this, I have two different lives. I do this aesthetic medicine thing, and partly because if you watch the first episode of this podcast series, I talk about this. But started this medical spa when my brother was in plastic surgery residency. Blah blah blah. We have a big medical practice. You heard about me through a friend of you or a cousin.
Mm-hmm.
Right? We meet when your firstborn
Mm-hmm.
was born.
Mm-hmm.
I didn't see you in the hospital though. I didn't round on you.
You didn't see me in the hospital, but you were my first appointment. You saw him very, very little.
That's awesome.
Yeah.
And I was like, hey guys, and you were this really cute young mom, and it was awesome.
I was terrified.
You were,
I was like the most nervous mom you've probably ever seen.
But you were always smiley. Like when your nervousness was always like you were actually kind of chipper and happy. Nervous, but not that, it was good. It was actually
I was happy
good.
he was out of me.
Yeah. So I've never been pregnant before, but I feel like I would be like that too.
Yeah, no,
Yeah.
It was good. It was good.
You're an amazing mom. Are you kidding me? Yeah. We kind of hit it off right off the bat,
did.
right?
We did. There was a lot of trust.
There was, yeah. And I feel like our appointments were awesome.
They were.
And so then we got to know each other because we see each other a lot.
Mm-hmm.
Yeah. And we see each other like monthly.
Yeah, well, every time I kept coming in, I would tell you how I just didn't feel like myself and I blah, 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 I was tired, whatever. A lot of it was obviously regular postpartum stuff, but that's how I came to see you for the Life Op program.
That's right. And I was like, hey, I got some options for you.
Yeah. And it took me a while because I didn't buy it at first.
No, I know. It was not till this past summer.
Yeah.
Right?
Right.
Yeah, it was like June.
It took me like a year to get on board with. And I wish I had gotten on board with it sooner, but
it was perfect. Actually.
It was good. It was good.
You allowed your body to heal
Mm-hmm.
and to get back to like baseline, I would say. And
Yeah.
I think that what you were having a hard time with was, I guess, just hormonal fluctuations and maybe some cortisol.
It wasn't even like the number on the scale, which I think a lot of people think that's what it's about. It wasn't about that. It was about this inflammation, swollen feeling that no matter what I did, it wouldn't go away. And it would drag me down.
And you're super
active.
You're
oh my God.
Very active. You're like one of the most active people I know.
I worked out until I was 42 weeks pregnant.
Yeah.
And then was working out ever since.
You were. And you actually looked great. I mean, most people like when I show, when people look at your before photo, they're like, oh, she was great, before.
Yeah.
But you didn't feel as good as you knew you could feel.
Yeah. I would again say like it was so much less about the number or like the weight and so much more about like this inflammation, swollen, exhausted, no energy feeling.
Which I think a lot of women kind of go through.
Yeah. And I think a lot of women write it off as like normal or like, oh, well, this is just postpartum or, oh, this is motherhood when it's not.
Right.
It doesn't have to be.
It doesn't have to be.
It doesn't have to be.
Yeah. I learned a lot from actually your firsthand experience has allowed me to practice differently. Actually, it's kind of like proven a lot to me.
Yeah.
And then I've been able to replicate kind of like what we provided for you with so many other women.
That's
and I think
great.
it's really honestly helped.
I mean, it's made
so
me a
many
better
lives.
mom.
That's
for
awesome,
sure.
dude. That makes me feel really good. That's awesome. So like, let's go through it. So we, obviously we're seeing each other a lot because of Anthony, and then we, I think I was like, hey, listen, I think I have some options for you. You would really be helped by, this microdosing of Tirzepatide that we do.
Right.
And I think, you were like a little skeptical. You're like, wait a second, I don't want to like do,
Well,
take
everyone
weight
thinks,
loss stuff.
right. Everyone thinks it's Ozempic.
Right. And in some respects, I mean, yeah, it's a GLP,
Right.
and it was marketed because, I mean, it works wonders for people that are massively
Absolutely.
overweight and blah, 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 blah. And, diabetes risks and stuff like that. But then I realized just by doing it a bunch and practicing with this, particular medication, that it had massive anti-inflammatory effects and like even more so like cortisol and interestingly, I assumed it had balancing of like female hormones, because I kept seeing observationally, back in the day, like medicine was before studies were done, doctors would just observe things and then they would be like, oh, okay, that makes sense. And they would see patterns. Right. And so you see enough patterns, you start,
practice it.
Okay. Yeah.
Right.
This makes a lot of sense.
Yeah.
Right. So that's what we were seeing here. So I'm like, that's pretty interesting. So anyway, we put you on this micro dose of Tirzepatide, and I think right off the bat, it started like really working well for you.
Yeah, I
Take
would
me
say
through that.
I call myself like a super responder to it. Like I think
I love that.
it was like the first dose. I remember texting you being like, "Am I supposed to feel better like
I do
right
remember
now?"
that. Yeah.
And you were like, "Yeah, you are."
Mhm.
And I didn't believe that again. So it
You're like
was
placebo.
Yeah, I was like, "This is in
Yeah.
my head." But it did. It worked. I think I started it in June, and by like the 4th of July, I was like a whole new person.
Yeah, that was
And
awesome. to
again,
see.
I'm like not even talking about weight, just like energy and like inflammation was down, and I didn't have this like emotional attachment to eating a bag of chips that I needed.
I feel like you actually got more glowy too. Like I don't know. It's kind of hard to put into words, but you just
some of it was
looked like
confidence.
healthier or something. Yeah. Maybe,
Some of it was
maybe.
confidence.
Yeah.
Because like it wasn't
Yeah.
hiding behind
Yeah,
being so
maybe-
exhausted anymore.
Maybe that was. Yeah. But I mean, what was so cool though is that you maintained. So, you came into this, fit and stuff like that, right? I mean, you had muscle underneath because you're an athlete, from when you were younger and stuff like that. So you were just like a naturally athletic person or whatever. So the muscle, you didn't lose any muscle, which was, I think you were worried about that. You're like, am I going to lose muscle? And I'm like, no, not at this dose. You're not going to lose muscle.
Right. I was very worried about, so I was a type of athlete that went to the gym 7 days a week.
Yeah.
Even when I was pregnant.
Wow.
7 days a week, I was either running or lifting or doing something.
That's awesome.
But I never saw a change in like aesthetically how my body looked, which was really frustrating.
And this is even after Anthony, you're saying.
This is my whole life.
Yeah.
I never ever saw a change aesthetically in how my body looked, no matter what kind of.
So before Anthony.
Before Anthony,
okay.
after Anthony, never saw a change.
Interesting.
It wasn't until doing this, microdosing Tirzepatide,
right,
that I was able to actually see the results.
Oh, that's so cool.
From going to the gym.
I don't think you've ever told me that before.
Yeah.
That's
awesome.
awesome.
Well, surprise.
Thank you. I knew there'd be something on here. That's awesome. That's okay, cool.
Yeah.
That's so cool. All right, cool, man. So, all right. So then you start it, and then I think we started like, well, how much, let's go over that really quick because everybody's going to ask, like, how much weight did you lose?
So I started my postpartum weight, which was probably around my regular weight was around 140. Maybe I weighed in that day at like 141.
Yeah.
And
how tall are you?
I'm 5'4".
5'4", yeah.
Yeah.
And
so
that was heavy for you.
It was probably like, it was a little heavy. I'd say regularly 137 maybe, but like in the ballpark.
Yeah, got you.
And I would say incrementally I lost about like 2 pounds a month on it maybe.
Yeah.
And went down and down, and now I'm down to 119, 118, but I feel like this is the weight I'm supposed to be at.
Yeah.
Like I don't feel like it's an unhealthy weight. I feel like it's the right weight.
And we do this body scan on you, so it's like your skeletal muscle mass has maintained like tremendously, which is awesome.
Yeah.
And you still work out.
I haven't changed anything. I still lift heavy weights. I still run. I still walk when I can.
Energy was great and stuff.
Oh yeah.
So that's awesome. And that's kind of what we were, as we were seeing each other through this microdosing Tirzepatide thing, I kept asking, like, how do you feel? Like how do you feel at this weight? And what was cool was that you were very honest, but also you were very in tune with like, where you were and like where you felt the best. And that kind of gave me a lot of good feedback so that we can like figure out the proper, approach for you. Right.
And we did a lot of like kind of guest test and revise with like, when to give
Yeah,
the dose.
that's
like
right.
sometimes we did it weekly, and then
Yeah.
sometimes I'd be like, all right, well, I want to give it
Yeah.
a break. And you say,
Yeah.
okay, great. We'll skip a week in between. And we'd go back
right.
and forth and found it.
What else has it helped you with? Have you noticed like better, I guess, like mental clarity and things like that? What have you noticed?
Number one thing other than like body aesthetics would be sleeping.
Okay.
And again, I had a 2-year-old. I have a 2-year-old.
Sure. Not easy to get some good sleep.
Right. But I feel like it's an easier time to go to sleep
Mhm.
and I'm staying asleep, whereas I would be waking up constantly. And again, I think it's probably related to cortisol because I think your cortisol
Probably.
kind of spikes at certain times in the
Mhm.
night. So sleeping has dramatically changed since June, since going on it.
That's awesome.
Yes.
That's really awesome.
And bloating. Oh my God.
So that's the thing. Yeah. So
Forget what I just said. Bloating is the number one.
that's your number one thing.
100%.
Cool. So this morning skinny, we
Morning skinny.
yeah, actually we developed this term, which is trademark, by the way, so you guys can't use it. We have a morning skinny program, and that's actually, I think, kind of what we're doing. We'll just say this is the morning skinny program. But anyway, morning skinny is this is what Stephanie would talk about, and I think one of the girls that Nina, who's part of our medical spa, she's our nurse practitioner there. She also did a little microdosing before her wedding.
Yep.
And both you guys, I think, kind of talked about each other, both of your, experiences with all this stuff, right?
Yes, we
And
did.
you were like, oh my God, morning skinny.
Yeah.
Yeah.
It's
I think everybody can kind of understand that. So you're morning skinny all the time?
all day long.
That's
And
pretty awesome.
Oh my gosh. It's the best thing. You don't
Yeah.
have that like 2:30 afternoon total slump and bloating and like it's just
That's
the way you
amazing.
wake up,
Yeah.
you are all day long.
What do your friends think of it? Like, so, you have a great friend group and girls are pretty honest with each other, right? You've known these girls for a very long time. They all knew that you did this kind of thing.
Yeah.
Yeah. What'd they think of it?
I think a lot of girls get scared by it because they think Ozempic and
Yeah.
they think the negative connotation to Ozempic.
sure.
And they're like, well, you're skinny. Why do you need it?
Why would you need that? Right.
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 So at first it's a little jarring for them.
You're like, what?
Right.
What-
And a lot of people also say like, oh, well, it's like the easy way out,
Right.
which is
So-
also not very true.
I don't know if we actually said this in the beginning. I definitely did not say this, but there's therapeutic doses and then
Right.
sub-therapeutic doses. When we talk about microdosing, I never gave you a therapeutic dose of Tirzepatide. The traditional dose of like 2.5 milligrams.
Never.
No, because you didn't need it.
Nope.
Because you're not obese.
Right.
So so the medicines act differently at different doses. For instance, let's just talk about one that's sort of well known, I guess. Spironolactone. So spironolactone is a medication that's a potassium-sparing water pill, diuretic, right? It's used at lower doses for a lot of times for women because if they get cystic acne, because it doesn't allow for estrogen to go down
Right.
the testosterone pathway. Now, if you use it at higher doses, it's used for like old people to maintain their potassium and then have them also pee out some stuff so they don't have high blood pressure.
Right.
So Tirzepatide, I don't know if that makes any sense to everybody, but my medical people out there probably does. Tirzepatide at like lower doses, less than 2.5 milligrams, works wonderfully for cortisol and getting you that morning skinny.
Right.
So, yeah.
So
Anyway, back to your
It
friends.
was jarring for them because exactly, they don't have all the information.
Sure.
A lot of people don't have all the
Yeah,
information.
they do not.
And I feel like a lot of girls or women who start this kind of thing, they start it quietly, like they don't want to talk about it.
Mhm.
But I don't do anything quietly, so I've said it with my whole chest since
Yeah.
the day I came on it.
Yeah, yeah.
But now they've really seen like, oh, this isn't something that's just about her getting in a smaller size jean,
For sure.
right?
Yeah.
Like, this is giving her energy. This
Yeah.
is making her feel better. She's able to sleep better.
Yeah.
They see it. They see it on me.
Gave you back your life in some ways. Like the life that you want to live, I
Absolutely.
guess you
Yeah,
could say, right?
you feel better. And
Yeah.
there's nothing wrong with doing something healthy that makes you feel better.
That's what I'm saying. I think that the world's coming around to it though. As you probably
I
see
hope
this
so.
more.
I think
Yeah.
we need more people talking about doing it.
It might be my algorithm, but there's definitely more like talks about it. I don't know if everybody's getting that type of stuff, but yeah. And then this GLP-3 that's coming out, this retatrutide.
Yeah,
that's
it's Retta.
Retta.
Yeah,
Everybody's like
everyone's
Retta.
talking about Retta.
Retta. Yeah, that's a cool thing. We have a few people, so I have it at the medical spa.
Yeah.
And we've been dabbling with it. It's been very interesting.
Yeah.
stuff. But anyway, so back to your journey. So so right now we still actually haven't seen you in a little while, I guess, right? For the Tirzepatide, or where are we at right now? I think you get it every couple of weeks,
every super low dose. I think I'm on like 1 milligram.
I think that's about it. Yep.
And you and I have like kind of customized it to fit when I need it. We've tried 7 days, 10 days, and now I'm actually at every other week.
So let's talk about the other things that people are afraid of, like constipation or
I've never had that.
Never, right? Yeah. I think
time.
you messaged me and you said, everything is working even better.
Literally.
Which was so cool to hear.
Absolutely.
Which is,
but again, people are taking those because they're thinking about the side effects from an Ozempic dose.
Exactly. And this is so interesting. So the other thing that people don't realize is that with these small doses, I've actually not had anyone lose skeletal muscle mass.
Yeah.
Which is so cool.
I think the main thing is losing the inflammation.
Yeah, it's pretty cool. So, what would you advise people? Like, who's this for? Like, who best is suited for this life optimization, this morning skinny thing that we got going on, this morning skinny program?
I think I would say, like, if you don't feel good, and you don't feel like yourself, then you are somebody who needs to talk to Dr. John about it and see if it's something that fits for you. If you're not feeling good, it's time to feel good.
I like that.
And the fact that like I finally feel good has changed everything.
Yeah, that's amazing. I'm happy to be part of that.
Yeah, dude.
Yeah, that's the best. Thank you so much. I was like fishing for a compliment.
I know, I gave it to you.
I know, thank you. So let's give you a plug. So Stephanie, you're quite the accomplished real estate agent and mogul. I don't know. So
working on it.
Yes, exactly. Well, I think that you're on your way. So you're mainly in LBI.
Yeah, I mainly do all the shore points in New Jersey.
That's awesome.
Anywhere where you see water and horizon.
I like that. So where can people find you, Stephanie?
You can find me on Instagram.
Oh, yeah?
Steph Sells LBI.
I like it.
Yeah.
That's a good handle. So Steph Sells LBI. You heard it here. Go check her
for
out.
The plug.
Yeah, man. And go check her out. She's fantastic. And she'll tell you more about our life optimization program too, right? There you go.
Anything you want to know.
Thank you. I appreciate you being on here with us and telling us your story.
Anytime.